Hello everyone, this is Dr. Priya Singh and welcome to New Roots Hair Clinic. Today we are here to discuss Dutasteride or Finasteride, which is more suitable for hair loss. I am sure many of you are already familiar with this medicine, but some of you may not know about this. So let's talk about this in details. I often get questions like, is Dutasteride or Finasteride safe, or does it have any side effects? Let's start with discussing mechanism of action of both Dutasteride and Finasteride. Well, Dutasteride belongs to a group of drugs which is called alpha-5 reductase inhibitor. It blocks the action of alpha-5 reductase enzyme. Its main function is to convert testosterone into dihydrotestosterone, which is DHT. This is why we call Dutasteride and Finasteride as DHT blockers. Please remember that there are three types of isoenzymes: 1, 2 and 3, and Dutasteride inhibits three forms of alpha-5 reductase. Thus, it decreases the level of DHT in your body by almost 98%. Now talking about Finasteride. Finasteride works in the same way, but it only inhibits type 2 and type 3 type of isoenzyme. It does not work on type 1. So this is the reason why DHT level in your body is decreased only up to 65 to 70%. According to a study which was conducted in America in 2014, it was found that Dutasteride 0.5 mg was more superior to Finasteride 1 mg when it was given at week 12 and 24 in increasing hair count. So the conclusion of this study was that Dutasteride, when it was given in short term, it was shown to give more or improved results as compared to Dutasteride. However, we don't have much data about the long-term results of Dutasteride. Both oral Finasteride and Dutasteride have shown to prevent hair loss in men with androgenic alopecia. Since Finasteride is the older drug as compared to Dutasteride, we have more data on its effectiveness, safety and its long-term effect. For that reason, we at New Roots Hair Clinic provide customized dose of Dutasteride or Finasteride. Like if a patient is suffering from severe androgenic hair fall in the past 5 to 6 months, then we start them on 0.5 mg regular daily dosage of Dutasteride for 3 months, and after that, when the condition has stabilized, we switch him to alternate daily dosage for the next 6 months. What it does is it helps reducing the side effects, and it also maintains low DHT level in the scalp. If a patient's age is less than 25 and has minimal hair loss, but still the hairline has started to recede back, in those patients what we do is we start them on half dose of Dutasteride, like 3 to 4 tablets a week. So in this way we adjust the dosage depending upon the severity from when the hair fall has started. I think this is all just a matter of experience and it comes with time. Now let's talk about what is the main difference between Dutasteride and Finasteride. Well, the main difference is intensity of effect. 1 mg of Finasteride blocks about 65 to 70% of DHT, whereas Dutasteride 0.5 mg blocks more than 90% of DHT level in your body. This means that Dutasteride is more potent and effective in stopping the conversion of testosterone into dihydrotestosterone. DHT is the main reason why hair fall happens. So once you start taking Dutasteride, what it does is it helps in more hair growth and helps in thickening of the existing miniaturized hair as compared to Finasteride. Now let's discuss the most frequently asked part of this question, and that is, what are the side effects of Dutasteride? Well, users may experience some sexual side effects like a decreased libido, erectile dysfunction or a problem in ejaculating. However, all these side effects are rare and they are generally reversible. It is worth noting that if these side effects are happening for you and for some reason you have decided to stop it, then please remember that it takes a little while for the side effects to disappear, because the half-life of Dutasteride is longer than as compared to Finasteride. It takes somewhere between 4 to 6 months for Dutasteride to get completely washed out of your system, whereas Finasteride takes few weeks. Now let's move on to the next part of this topic, and that is, how soon will you see the results of Dutasteride, or when will you see the results of Dutasteride? Actual results of Dutasteride can be seen somewhere in between 4 to 6 months after starting the medicines. Most men will notice less hair fall or growth of new hair in this period. patients taking Dutasteride should continue it for at least 1 year. Initially, when you start using Dutasteride, you'll notice little thinning of hair. But like I said, you have to keep patience and please keep using it. I hope this video was helpful to everyone, and I'll see you again with a new video. Till then, please take care.